Morning, guys. How's it going? Hope you're all having a great Wednesday. I'm going to pull this up on my phone too so I can see comments or questions as they come in. Bear with me here, and we're going to wait for a couple minutes for other people to join in. And then we'll go ahead and we'll get started in just a second here. Hey, Sadie. Yeah, so these exercises will definitely help with that. And these are the exercises we'll be going over today will be things that you can implement, you can do immediately, like upon waking up, that will help decrease some tightness or low back pain that you might be experiencing as well. Okay. All right, and then yeah, we'll go ahead and we'll get started. So this can be super informal. I want you guys, if you guys have questions, just put those in the comments, and I'm going to answer those as I go along. If something doesn't make sense, let me know. All right, I guarantee other people have similar questions as well. So I'm here to help, and I don't want you guys leaving this webinar or this Facebook Live with questions. All right, my goal is to answer any and all questions that you guys have, and make sure we can get you out of this low back pain as fast as possible. All right. So if you guys are experiencing low back pain and you may be noticing that this is impacting your ability to work out, and you're looking for ways to fix that and be able to live your life without low back pain, without it getting in the way, you are in the right spot. I'm going to introduce myself. So my name is Dr. Ben. I'm a physical therapist with Pro+Kinetix Physical Therapy and Performance in Uptown Oakland. We specialize in helping active adults and athletes in Oakland and the surrounding Bay Area get back to workouts and sports they enjoy without a fear of low back pain impacting that. All right. Oh, question just came in. Will this be recorded so we can view later? Or no, you do not need to be fiercely taking notes or anything like that. This is being recorded, and this will be uploaded into the Facebook group as well. And you guys can also ask questions afterwards. If you're watching this on replay, just go ahead and type in the comments your question. Also make sure to include my name in there so I get a notification that you've asked a question. All right. If you don't do that, I won't get that notification. So I want to make sure I'm helping for anybody that is watching on this replay. Okay. So a little bit about me. A little bit more about me. So I'm a doctorate of physical therapy, and also I'm a certified strength and conditioning specialist and USA weightlifting coach. And so my specialty is really helping people get back to exercise, whether that's squats, deadlifts, rock climbing, running, and making sure that this back pain is taken care of. All right. So some objectives today is identify the most common causes of back pain, give you guys some effective exercise, and go over some treatment for low back pain, and then also strategies for prevention of injury, and then most importantly, answer any question that you guys may have. All right. Some fast facts on low back pain. So it's a single leading cause of disability worldwide. Years lived with disability caused by low back pain has increased 54% in just the last 15 years. And that's because we're working more and more at a sedentary job where we're sitting more. 80% of the population will experience back pain at some time in their lives. And this is causes $50 billion in healthcare costs each year just from low back pain alone. So it's very prevalent, all right? And you are not alone. And this is something that can be fixed, all right? That's one key point I want you guys to take away from this is knowing that you do not need to get injections. You do not need to get surgery. You do not need to get injections, medication, surgery. You don't need any of that to be able to get back to being pain-free, okay? It does not take invasive measures to that extent, all right? There's conservative, easy ways through exercise that we can get you back to doing everything you want pain-free, okay? So we're gonna go over a couple of the most common types of injuries. So you guys can, again, I don't want you guys self-diagnosing yourself, but we're gonna kind of talk about some things with regards to different types of injuries and how they present and what you may or may not be experiencing with these certain types of diagnoses. Okay, it's super important to seek out a medical professional to get an accurate diagnosis. Don't diagnose yourself, right? So one of the most common causes is disc herniations. Okay, disc herniations occur for a variety of reasons. Okay, to give you a little bit of background, we have, so I'm going to use this as the best model I have right now. So we have our low back. Okay, we have there should be a nice curvature in the low back, right? And we have vertebrae that are bone that are stacked on top of each other to make up that low back. Okay, and in between each vertebrae is a disc. Okay, that disc is full of fluid. All right, and when it comes push to shove versus vertebrae, which are bone, and a disc that's full of fluid, guess which one's going to win? It's the vertebrae or the bone. Okay, so if we start losing that curvature and we start rounding out like this, now we're going to start getting some pressure on that front part of that disc, and it's going to push that disc back. Okay, so this can occur if we bend over and pick something up really heavy with improper form, or if we sit for long periods of time with bad posture. Okay, so what this does is it pushes the disc back, and there's nerves that exit the back of the spine, and it can compress down on those nerves and cause pain down the back of the leg. Okay, so that's herniated disc in a nutshell. All right, and that's what we see most commonly. And then we also have degenerative disc disease. This is usually seen as we age. So that fluid that's in that disc decreases as we age. It gets more and more narrow, right? And there's less and less space between the vertebrae, so you can get pinching, okay, and back pain because of that as well. All right, and then we also have spinal stenosis, and this can be a byproduct of degenerative disc disease. All right, so we have the back of our spine and then the front of the spine, and we have those nerves that exit the back. Right, and so if we stand for a long period of time, or get too much extension, or doing like press ups or something like that, what we do is we actually get that bone pinching on the other bone, and we can get some pain with that. So if you see somebody in the grocery store that's leaning over their cart, 9 times out of 10, they have spinal stenosis. By bending over and rounding out over that cart, they're able to relieve that pressure. Okay, and they're opening and putting a gap on the backside of their spine to open up that space for those nerves to travel. Okay, so that's spinal stenosis. Another thing is muscle spasms. Okay, muscle spasms can occur just randomly, and they can be frustrating. And a lot of times these muscle spasms happen because the muscles of the core are not doing their job. And so the spine wants stability. And to get that stability, if they're not getting that support from the core, it will start searching for any and every muscle, okay, to provide that support, even muscles that aren't supposed to be providing that support. And these get overworked, and then they become spasmy and can create pain. Okay, so I see a lot of people go get a massage, do foam rolling, stretches and stuff like that, but it keeps coming back. And that's because they're just treating the symptoms. They're not treating the root cause of it. The root cause of it is the core weakness that they have. Okay, and that's why it's a vicious cycle. You want to get to the root cause of it. All right. Another thing, lastly, is piriformis syndrome. Okay, or sciatica is something that we see a lot too. And this doesn't always just come from the low back. It can also be coming from the glute tightness and weakness. So the sciatic nerve travels out from the low back, right? And it travels down the backside of the glute, down the back of the leg, all the way down into the toes. And a lot of times, if we have that pinching of the disc on that sciatic nerve due to the disc herniation, we can get that zinging down the leg. Or, like I said, it travels down underneath the glute. There's a glute muscle called the piriformis. It's a very, very small muscle. It's not supposed to be doing a whole lot of work, right? But it will if, again, those muscles are not doing the job that they're supposed to, such as the big glute muscles. If those aren't doing their job, then this tiny little bitty piriformis has to take the brute force of it, and it becomes overworked, gets tight, and guess what travels underneath that piriformis muscle? That sciatic nerve, and that produces sciatica, all right, and that pain down the back of the leg. So it could be coming from the back, could be coming from the glute or the piriformis as well. So we need to screen that out as well. And I don't encourage you guys to try and screen that on your own. Okay, there's orthopedic tests and measurements that that licensed professionals can do to rule that in or rule that out. Okay, so there's a couple other things that can cause low back pain. but majority of people will fall under those 3 or 4 categories. Right? That's what we see the most. Okay. So we're gonna get into some treatment. If you guys have any questions about that, let me know, or about the different diagnoses, just let me know. Okay. I know that's a lot of information and it's kind of complicated. I try to make it as basic as possible for you guys to understand. But there's no questions. We're gonna move into treatment. All right. So treatment first phase is we need to find and understand the cause of it. Right. We can do all the treatment we want, but we need to understand where is this stemming from. Is it the way that you're working out? Is it certain exercises that you're doing incorrectly or should not be doing at all? Is it the way you're sitting? Is it the way you're sleeping? Is it the way you're walking? Is it because of muscle imbalances and the sort? So there's a lot of different things that could be contributing to this. So we need to find and understand the cause of it before we move any forward. All right. And the next thing would be restore range of motion, decrease muscle tightness. Okay. Tightness can create pain. And so when we can release those muscles, we get the pain relief. Okay. Then the next phase is strengthening, right? Because we can do a stretching and mobilization and foam rolling as we want, but again, that's just treating the symptoms. We need to get to the root cause of it, and that's the core strengthening, the hip strengthening, the glute strengthening, and finding ones that are at the appropriate level for you. I see a lot of people that go on YouTube and search what's the best exercises for low back pain, right? I just listed off 4 of the different diagnoses that we see commonly. There's tens. Okay, there's so many different types of injuries that can be happening in the low back. It's not a one size fits all thing. And on top of that, everybody's got different levels of strength, right? One exercise that you find on YouTube might be too hard for you and not hard enough for another person, right? So you can't take a cookie cutter approach with that. And a lot of times I hear a lot of people actually cause more damage by searching for these YouTube videos. Okay, so I encourage you to get something that's tailored to you and your individual body, because everybody's different. Okay? So strengthening is huge. Lifestyle modifications, weight loss is huge. Decrease or limit smoking if you're a smoker. Nutrition, make sure you're getting enough water intake. Make sure you're getting enough protein intake. And then also activity modification. Okay, so make sure, if you're, like for me, I get in a rut sometimes. Even physical therapists aren't perfect. All right, I get in a rut of just doing strength training. All right, I need to do more variety, and something I've been working on is doing running more, go swimming, biking, stuff like that. Things that that are challenging your body in different ways, so you don't get in a rut of doing the same thing over and over again, and it makes your body more resilient as well. Okay, because there's not one activity that's going to bulletproof all your different muscles and whatnot. Okay. So that's a good start to the treatment. And then one common questions that I get is, should I be using heat versus ice? Right. So to answer your question, it's whatever feels best for you. If you get more relief from using heat, use heat. If you get more relief from using ice, use ice. Some general guidelines though are, if you're experiencing muscle spasms, we want, those muscles are tight. We need to get those to release and relax. So heat is relaxing. All right, we can get a lot of relief from that. However, if we injured that area recently, we may have some it's an acute injury. There's probably inflammation that is going on in that area. So we need to remove that inflammation, which will in turn reduce pain, so we can use ice for that. Okay. Then also get into questions about back braces as well. Should I be using back braces, and what does the evidence say with that? So I'm pretty against using back braces unless you're having excruciating pain. If you're having excruciating pain and you put a back brace on and it helps immensely, go ahead and use the brace, but we want to slowly wean you off of that. All right. The back brace, we actually have a built-in back brace. It's called the transverse abdominis. Okay. It's like a corset around the core. And if we get that to activate, it does the exact same thing what a back brace should be doing. Right. And when we use back braces, it actually makes that transverse abdominis even weaker, because it doesn't have to be doing the work that it's supposed to, because that back brace is now providing that support. Okay. But again, it takes time to build up strength. So if you're having excruciating pain, you can go ahead and use that back brace. Okay. Hopefully that makes sense. Then lastly, if this has been going on for weeks or months and you've tried different things, you need to make sure that you seek a medical professional that understands what activities you're trying to get back to and understands your goals. All right. I have so many people that come in and be like, oh, my physician just told me that to rest. Or if that doesn't work, then we'll do surgery or we'll do injections. That's like bed resting is like one of the worst things you can actually do for low back pain. You need to keep moving, keep being active, and keep those muscles activated. Because if you go on bed rest, what your body does is it's like, okay, this is a safe place. And then when you go try and move and work your way out of bed rest, your body's like, wait, what are we doing? We shouldn't be moving. We are in a safe place, right? What are we doing moving? And so it starts getting in protective mode, and it increases your risk for future injury or increase in low back pain down the road too. Okay, so stay active, but do it in ways that your body can tolerate without aggravating or irritating that area. Okay, so that's super important. Do not go to injections, medications, and surgery. That should not be the first combat of action. It should be exercise, tailored exercise to you and your individual problem. Okay, all right. So that kind of wraps up the treatment. Before we get into the exercises that can help you guys, do you guys have any questions about that? Again, I know it's a lot of information. All right, just put those in the comments if you have individual questions. While I get set up, I'll let you guys put those in the comment section. Let me go ahead and get this set up so you guys can, so we can start doing the exercises and whatnot. All right, and then disclaimer, all right, I haven't done any assessments on either of you, all right? We're gonna be going over exercises that, that it's gonna help the general population, okay? And it's not, if you have pain with this, with any of these exercises, stop, okay, and let me know. These exercises are just telling your body what it needs and what it doesn't need. If you have pain, just your body's way of telling you that you need something different. Okay, and it actually helps point us in the right direction of what you do need. Okay, if these help, great, you're on the right track. Okay, it's a great place to start establishing a foundation. However, you will eventually, again, these are lower level exercises. Okay, but we got to establish a good foundation before you can start leveling up, okay, into more exercises. But this is a great foundation. Okay, so we talked about how we can get muscle spasms and that can be painful, right? And I think Sadie, let me see, I think it was Sadie that, yeah, Sadie was saying that she was having some low back pain, especially upon waking up. And so the exercise we're gonna go over right now is a perfect exercise to help with that. Okay, and so what exercise I give all my patients if they have the similar complaints. If you guys don't want to like have to watch this on replay to get these exercises, just put in the comments that you want a copy of this routine. And what I can do is I can just send you a video description, a written description, how many reps, how many sets, how long you should be holding these for, and stuff like that to make sure you're doing them correctly. So just put your email address or just private message me, and I'll go ahead and send that over to you guys later today if you guys want that. Okay, so let's move into that. So what I'm gonna have you guys do is lay on your back, and that's why it's so great. This exercise is so great is for back pain when you wake up, because guess what? You don't have to get out of bed to be doing it. So what you're gonna do is you're gonna be laying on your back, okay? And what you're gonna do is you're gonna put your arms by your side, or you can put them out here, okay, for leverage. I tend to put them out here to counterbalance this. And what you're gonna do is you're just gonna start doing slow, small oscillations of moving your knees side to side. Okay, so start with small oscillations. And as you get more comfortable and those muscles start loosening up, then you can start going a little bit further. Okay, so you notice how I'm going really slow. We don't want to be flailing around like this. Okay, nice and slow and controlled. Focus on your breathing. Make sure you're keeping your shoulder blades and your shoulders down. What we don't want is your knees going to the left and then your arms coming up, because now we're losing some of that anchoring we have at our shoulders. We're just going side to side like this. And then if you feel tightness on one side more than another, you could just relax and kind of pause and focus on deep breathing. For those of you that have gone to a chiropractor in the past and they kind of like crack your back and manipulate it, you may get a few cracks and pops with this, and that's okay. As long as there's no pain, it's actually a good sign. We're just loosening up the vertebrae there. All right, you can do like 10 to 15 each side. Do 5 more each side. We'll move on to the next one. again, if you're having pain with any of this, stop and let me know. But it should feel pretty darn good, actually. Should be relaxing. So what we're doing is we're just rotating the vertebrae. Okay, the spine likes movement. We need to keep it mobile. Okay, so this is a great way to do that. Okay. Any questions on that one? Okay, that's an awesome one to start. Let's see here. We got a few questions here. Are some sports that cause more lower back pain than others, or is it different person to person, such as running or climbing? Yeah, there can be some sports that put you at increased risk for lower back pain than others. However, you shouldn't be limited. Your body everybody should have the capability to do rock climbing, to run, to do all these different things. Okay, and you just need to build up that capacity. Okay, hopefully that makes sense. And then yeah, it can be different from person to person based on their core strength, their mobility, and their previous history of low back pain too. Another question for low back as well as hip flexor, hip adductor pain. Do you recommend foam rolling and stretching? And then also before or after exercise? So that's a great question. So actually, this is what I did my doctoral research on was what's the best way to warm up and what's more appropriate before or afterwards with regards to stretching. You're better off doing a dynamic warm up. What I mean by before you work out, what I mean by that is like if I'm going to be doing like squats that day, guess what I want to be doing? Or like weighted squats, guess what I want to be doing? I want to be doing movements or exercise that are going to replicate that. Okay, such as like just doing air squats or doing lunges. Okay, doing skipping or hopping or a light jog just to warm up those muscles. All right, because if we stretch a cold muscle, it's not going to stretch as effectively. Okay, when we are warmed up, that's when we start getting those longer tissue changes. Okay, so stretching afterwards is more beneficial. With regards to foam rolling, you can do that before or afterwards. I tend to do foam rolling before because foam rolling, it increases blood flow to those muscles that you're about to utilize and can help loosen that up and get you guys feeling better there too. Okay? So hopefully that makes sense. Doing the kind of stretch you just demonstrated is when I feel stiffness in my low back. Do I push through to loosen it or avoid this motion? So what I would do is it should not be painful. Okay, you may feel that stiffness when you do this. Okay, because we're starting to push that range of motion a little bit. I would just start with small oscillations. Don't try going all the way down to the floor like I did right away. Just start with small oscillations that you can tolerate right here. Okay, you should be able to tolerate these small movements. Okay, and then as it loosens up, you can go a little bit further. But yeah, if you feel stiffness in here, and with this exercise, it's telling your body that you actually need this, but you don't want to be pushing through this. It should not be painful. Should feel like a nice, gentle stretch. Okay. All right. So good, awesome, great questions, guys. All right. So what we're going to do next is we're going to go over some transverse abdominal strengthening. That was that low back muscle that we talked about. That kind of acts as a back brace. So what we do here is we go ahead and lay on our back. All right. And so this is the strengthening motion. And it's also going to help loosen up some muscles in the low back as well. So what you're going to do is you're laying your back, place your hands behind your low back. Right. And what you're going to do is you're going to push your low back into your hands and then relax, push down, and then relax. And then breathe out when you're pushing down. Breathe in as you relax. We're just going to do about 10 more repetitions of this. Ideally, you do 3 sets of 10 to 15. For today, just for time purpose, I want to make sure we get through as much variety of exercises as possible. We're just going to go through 1 set of this. So we're starting to move that spine a little bit and then also activate that transverse abdominis. You guys should feel the core kind of activate. Let's do 3 more. And this is another great one, Sadie, to be using right when you wake up. You can start with a lower trunk rotation, side to side. and then move into getting this transverse abdominis to wake up a little bit, okay, and provide your spine with the stability it needs just to wake it up, okay? All right, and that's another great exercise because guess what? You can do that. You can do that, you know, right when you wake up. You can just roll over on your back and do it, right? So that's a good one to start out. See if there's any other questions. All right. And Pauline, did that answer your question with regards to whether you should kind of push through it or not? The question you asked. All right, we're going to move into the piriformis stretch. Okay, so the piriformis stretch is going to help loosen up that piriformis muscle that we talked about that can cause some sciatica or sciatica-like pain. All right, so what we're going to do is you're going to lay on your back. And what you're going to do is cross your right leg over your left. And what you're going to do is you're going to reach behind your knee and then pull to the opposite shoulder. Okay. You should feel a nice stretch kind of in the glute area. And we're going to go ahead and do the same thing on the other side. And why don't you guys be aware if you start noticing a difference from side to side? Such as if you notice that you have more pain on the right side and you notice that's tighter, most likely the piriformis is causing some of that pain. You guys may notice some tightness on both sides. And ideally to hold this for about 20 to 30 seconds. Again, this should not be painful either. Right, and relax. Okay. So those 3 exercises are a great place to start. All right. So what I'm going to do is I'm going to reposition myself here. All right. Those are the 3 exercises I mainly wanted to go over today. Okay, and that's where you guys want to start. Okay. I gave you guys different exercises for low back for if you're having disc herniation, if you're having some sciatic-like pain or piriformis pain, if you're having muscle spasms. Those 3 kind of cover all those different pathologies. Okay. Once you get comfortable with these, then you can start leveling up, but make sure that you're leveling up appropriately in a way that's going to be beneficial to you. Okay. All right. What I want you guys to do is go ahead and put in the comments if you have questions about any of those while I move here and get repositioned. All right, guys. Let's go ahead and we'll head out here. So hopefully that all makes sense. So yeah, go ahead and start with those exercises and see how those go. Main thing is listen to your body. Okay, do proper warm-ups, cool downs. Spend the time that you need to warm up and cool down appropriately. Engage in a variety of exercises. Don't get in a rut of doing the same thing over and over again. Okay, all right. So it is common, like I said, if there's one thing that you guys can take away from today's workshop is if you go and see a physician or see a physical therapist or see a chiropractor, and the first thing they do is tell you to rest, or they tell them that, oh, you want to get back to running or working out, and you're having pain with it, and they just tell you, oh, just don't do it. If that's what you're having pain with, just don't do it. That's ridiculous. You need to keep moving. You need to keep exercising. There's no reason that you can't get back to doing that. This is what we really specialize in. We've helped hundreds of people with back pain get back to running, get back to rock climbing, get back to working out, and feeling confident in their body again, and not have to worry about, am I going to throw up my back? Am I going to hurt myself playing with my kids? Right? This is what we really specialize in. There's no reason you can't get back to that. Just don't settle for a practitioner or somebody that's going to tell you just to stop working out. Okay, and avoid the things that you really enjoy. All right. So I hope you guys found this super beneficial and whatnot. And again, if you guys want a copy of that mobility routine or the exercise we went over, just put in the comments below and make sure you tag my name, Ben Boggy, where you can private message me as well. And then I'll put my website too in the comments if you want to send me an email for more individual attention, or I'm happy to hop on a phone call with you guys too, to give you more individual attention and point you guys in the right direction as well, and see if we can help you out. Okay. But yeah, I appreciate you guys taking time out of your day to listen to me jabber and whatnot. But yeah, hope you guys find it beneficial. And then next week, I think we'll be going over knee pain or shoulder pain. I'll put a notification out on this Facebook group on what topic we're going to talk about. And if there's a topic that you guys want to specifically talk about next week, just put in the comments and we can tackle that one too. All right. But yeah, I hope you guys enjoy your rest of your Wednesday and rest of the week. And looks like it's gonna be a beautiful day here in Oakland. So get out and in a safe way and get some vitamin D. All right, bye guys.